overwhelming. And too much stress can impact your overall well-being. Heart disease is a top threat to women's health, and the Go Red for Women campaign is helping you take charge of your heart health. Dr. Heather Swales joins us live now. She is one of the directors of the Women's Heart Health Program for Hartford HealthCare. Doctor, good morning. Thanks for joining us.
Good morning. Thank you for having me.
Doctor, first, what are the signs and symptoms of heart disease?
So for most people, heart disease presents with some type of chest discomfort, a pain, pressure, tightness. It could radiate into the arm or the jaw. But for women in particular, they can have more subtle signs. They can also have other symptoms, such as trouble with their breathing, nausea or stomach upset, radiation into their back, an extreme, overwhelming sense of fatigue. So heart disease can present in different ways for different individuals.
Imagine some of this is hereditary. Some of it is, the environment and what you do with your daily life. What are some of the risk factors people should be aware of, doctor?
So common risk factors include things like diabetes, high blood pressure, high cholesterol, family history, especially if a first-degree relative has had heart disease at a younger age, sedentary lifestyle, poor eating, smoking, and lack of exercise are all common risk factors.
I mean, look, we all know in a pandemic, mitigating stress is not easy. How mindful should we be of stress, and what are some things we can do to reduce stress, which could ultimately lead to heart disease?
That is a great question. We've certainly seen with the pandemic increased problems with mental health, particularly surrounding depression, anxiety, and stress, as you mentioned. So I think doing things to help reduce stress, such as exercising regularly, and it doesn't have to be fancy. It can be simple walking, even inside your house, walking around the block or your property. These can all be great ways to relieve stress, as well as doing things like healthy eating, talking to friends and family or a healthcare provider if you are feeling overwhelmed, and just sharing some of the things that you're dealing with so that they can also help you by offering some support.
And a lot of it, doctors, is finding ways, especially I think for women, to find just a little bit of time for yourself. Kids, jobs, responsibility, that can lead to stress. But if you could just carve out a little bit of time, right, it can make a big difference.
Absolutely. Women are often multitaskers, and they're often the caregivers for numerous people, friends, family, children, parents. And so finding a little bit of time, even 5 or 10 minutes a day, can make a difference if it allows you to reduce your stress level.
Finally, doctor, what are the goals of the Women's Heart Wellness Program?
Signs and symptoms of heart disease, as well as reduce risk. We know that about 80% of heart disease is preventable. And so if we can catch it early, reducing the risks and getting risk factors under control, it can make a huge difference in long-term survival, as well as well-being and quality of life. And
the program, Go Red for Women, Take Charge of Your Heart Health, will be held Thursday, February 4th from 7 to 8:15 at night. So that's tomorrow night. It is free. It's a live webinar session. Participants will learn about the signs and symptoms of heart disease, risk factors, and much more. And if you saw some of that video, it was before social distancing became a thing. Obviously, this event is going to be virtual. Dr. Heather Swales from Hartford HealthCare, we appreciate your time. Thank you.
Thank you.